Olfactory neuroblastoma is a rare tumor first described by French author L. Berger et al. In 1924. It is a malignant neuroectodermal tumor assumed to originate from basal cell of olfactory receptor epithelium in the area of cubriform plate. Most commonly, tumor is situated in nasal cavity beyond the middle concha, and it is mostly olfactory origin in the area of cubriform plate. Tumor growth is usually slow, and over time, infiltration of adjacent structure take place in the direction of paranasal sinuses, oropharynx, nasopharynx, base of skull, even the intracranial in the frontal lobe. Metastatic spread is locally to the cervical lymph node, distally to lungs, bones, and through leptomeninges into the brain. And this olfactory neuroblastoma arises from basal cells within the olfactory neuroepithelium, and it represents about 1 to 5% of all sinonasal malignancies. And the incidence of this tumor is about bimodal presentation. It's common about 20 years of age and 50 years of age. Unlike most sinonasal malignancy, it is more common in the woman than the male. Slightly common in female than the male. And olfactory neuroblastoma is neuroendocrine tumor capable of causing paraneoplastic syndrome by secreting peptides. Patient with olfactory neuroblastoma causing Cushing syndrome, inappropriate antidiuretic hormone secretion, or hypertension produced by vasoactive peptides has been reported. Clinically, these patients present with nasal obstruction, epistaxis, headache, visual changes, and whitish pinkish mass in the nasal cavity because they are vascular, so that they present with pinkish in color in the nasal cavity. And advanced tumor, they may present with proptosis and intracranial complication if they extend to the intracranial cavity. Now workup. CT PNS, MRI PNS, and PET scan to rule out the metastasis are main investigation of choice. So for intracranial complication, you should do MRI. In MRI, you see this enhancing mass lesion because they are very vascular in the nasal cavity, mainly area of cubriform plate. And in CT scan, you can see expansible mass in the nasal cavity in the area of cubriform plate or olfactory region, which may extend nasal cavity and intracranially. You can see in this CT scan, this is the enhancing mass in the nasal cavity because they are very vascular, and they can extend intracranially as you see in this picture. It is going intracranially. The tumor is characteristically centered on the cubriform plate, where it extends downwards or upward. And this is MRI showing contrast enhancement in the area of cubriform plate. The Himes et al. Developed a 4-point histological grading. You can see in this picture depend on lobular architecture, mitotic activity, nuclear polymorphism, rosette, necrosis, calcification. On this fibrillary nature, he has given this grading system, and this tumor can be extremely aggressive grade 4 or relatively indolent grade 1. Another staging is Cadis staging system, or it is modified by Moritage modification. So grade 1, grade A is limited to nasal cavity, grade B it extends to sinuses, grade C is going beyond the sinuses like intracranially or into nasal cavity in any area nearby, And grade D is tumor extend distally. It can involve the distal lymph nodes or going metastasis. So this is Caddy's staging system for the olfactory neuroblastoma. Another staging system is Dulgero staging system, in which T1 is tumor involving nasal cavity and paranasal sinuses. T2 is tumor involving nasal cavity or paranasal sinuses, including the sphenoid sinus with extension of the cubriform plate. T3 is tumor extended into orbit and protruding into the intracranial fossa without involvement of dura. And T4 is tumor involving the brain. N0 no lymph node involvement, N1 any form of lymph node involvement. M0 no metastasis or M1 is any distance metastasis. The olfactory neuroblastoma is one group of small round blue cell tumors and need to be differentiated from cyanonasal undifferentiated carcinoma, neuroendodermal tumors, small cell carcinoma, rhabdomyosarcoma and lymphoma. So this is the DD of olfactory neuroblastoma. As you know, olfactory neuroblastoma typically express neuroendocrine markers, neuron-specific enolase, synaptophysin, chromogranin, and negative for creatinines. And S100 only helping to differentiate olfactory neuroblastoma from cyanonasal melanoma, and negativity of vimentin, actin, desmin exclude rhabdomyosarcoma. On immunohistochemistry, this shows positive for synaptophysin, positive for chromogranin, and it's negative for creatine. You can see in this picture. Treatment mainly wide surgical excision, endoscopically or open, followed by radiotherapy.